Hello everyone. In this video, we will talk about the classification of fractures. So fractures can be classified into different kinds based on different parameters. The first one is on the basis of etiology of the fracture. They could be traumatic, which is a fracture which is caused due to excessive force. Causes of traumatic fractures could include road traffic accidents, fights, and falls. You have pathological fractures in which a trivial or a mild force causes the fracture. Pathological fractures mostly happen due to any underlying disease which weakens the bone and causes fracture. Stress fractures happen due to chronic repetitive stress on any bone, which is seen in athletes or in soldiers. On the basis of the displacement of the fracture could be undisplaced or displaced. Undisplaced means that the fracture fragments more or less remain in the anatomically same position. Whereas in displaced fractures, the fracture fragments get separated from each other. This could be due to the fracturing force, which may pull or push the fragments away. It could be due to push by the muscles as well as due to gravity. The types of displacement could be a shift, an angulation, or a rotation of the fracture fragments with respect to each other. The next is on the basis of relationship with the external environment. So based on that, a fracture could be closed, which means that the fracture does not communicate with the external environment and the overlying skin and soft tissues are intact. Or a fracture could be open. It means that there is a break in the overlying skin and tissues and the fracture communicates with the external environment. The open fracture can be further divided into internally open and externally open. Internally open means that the bone lies outside. So the sharp bone fragment pierces the skin from inside and comes to lie outside, and that is called internally open fracture. Whereas an externally open fracture means that the object which caused the fracture pierces the skin and enters inside. Based on the complexity of the fracture could be a simple or a complex fracture. Simple fracture means that the fracture only has two pieces or two fragments, whereas in a complex fracture, the bone gets divided into multiple pieces or multiple fragments. Example, in a comminuted fracture. It becomes more difficult to treat a complex fracture than a simple fracture. On the basis of the quantum of the force causing injury, a fracture can be divided into a high velocity fracture or a low velocity fracture. High velocity fracture is caused by an RTA, and this includes soft tissue injury and devascularization, so it takes a longer time to heal. Whereas a low velocity injury is caused by a fall. Soft tissue injuries and devascularization are less, so it will heal faster and in a more predictable way. Lastly, you have fractures based on the pattern of the fracture. So in a transverse fracture, the line of the fracture lies perpendicular to the long axis of the bone. In an oblique fracture, the fracture line is oblique. In a spiral fracture, it may be due to twisting of a bone. So if this is the bone, it undergoes twisting, and that is how the fracture fragments get separated. In a comminuted fracture, multiple fracture fragments are formed. In a segmental fracture, one segment is separated from the rest of the bone.